Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Cain, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening, everybody. My name is Jocelyn Turner. Welcome to pauseforthetruth.com. Tonight, we're going to have a very interesting conversation as we normally do. Our discussion is who should enroll in Obamacare, also known as the Affordable Care Act. Joining me, of course, is our co-host, Dr. Rogers Cain. Dr. Cain, how are you this evening?
I am doing great as usual. Good evening, everyone. How you doing, Miss Turner?
I am doing just lovely. As we were talking before the show, it's one of my favorite times of year, as in the fall. It's not too hot and it's not too cool. How about you?
It's one of my favorite times of year. I guess for the same reason. We good.
Well, we're pleased tonight to continue the discussion about insurance coverage because it is that time of year as many of us are making the decision what type of health insurance plan is best for ourselves and our families. Our guests this evening are Benjamin Cain and Michelle and Brian Hicks. How's everybody this evening?
Doing pretty good.
Excellent. Doing good.
Doing wonderful, wonderful. Thank you all so much for joining us. At the end of the show, our listeners will be able to hear more about you. I know they're going to want to get in touch with you because you are going to give us a lot of good information tonight. So I am going to go ahead and get the conversation started. All right, is everybody ready?
Ready.
Eddie.
Fantastic. Well, I'm going to start out with probably the hardest question of the night. And Benjamin, I'm going to start with you. What is Obamacare?
Obamacare is basically what they call it affordable health care. It's widely considered the most fairly reach health care reform act since the Medicare, which is a U.S. government program that guaranteed health care insurance for the elderly back in 1965. But it is the most comprehensive, and I think the best plan has been put together since then as it pertains to everyone getting insurance or health care here in America.
Fantastic. Thank you. Michelle or Brian, do either of you have anything else to add?
No.
That pretty much summed it up, huh?
That
Yep.
sums it up. Yeah.
That was quick.
So,
Mhm.
so Michelle, I'm going to start with you because Brian was on last week. So we're going to let him pause and give you a chance to talk tonight. Who's eligible for Obamacare?
Well, individuals eligible for Obamacare, also known as the Affordable Care Act, you have to currently be a U.S. citizen or living in the United States. You cannot be incarcerated, and you fall within the guidelines of 100 to 400% of the federal poverty guidelines. If you make a lot of money, you don't qualify for it. If you make not enough money, you don't qualify for it. So that's who qualifies for it.
So I'm sorry, Michelle, but that sounds all too confusing right now. Whenever people talk about 100 to 400% of what's the federal poverty level line, I don't understand what that means.
Well, individuals that make less than $12,880, and that would be for one person,
Okay.
they wouldn't qualify for the Affordable Care Act.
Oh, wow.
Okay.
But can we
What's
say
their option?
Yeah, there you go.
Well, their option would be Medicaid or a
Oh,
temporary health coverage plan.
Yeah, one of the things that when it comes to, like Michelle was saying, Medicaid, Governor Scott didn't take the subsidy that the money that President Obama had made affordable for those that fall below the poverty line, which is, this year, it's going to be about $12,880 for an individual. And had they taken the money, everybody, even a homeless person, would have been eligible to receive the Affordable Care Act, but they turned down the funds. Most of the Republican states turned them down, with the exception of a few like Colorado and some of the, and maybe I think Kentucky or something like that. But so because of it, the people who fall below that 12,880 as for an individual, they don't qualify for coverage.
Right.
But that means, and what people don't understand is, and this is my opinion, we're going to pay for those folks one way or the other when they show up in our hospitals, our charity hospitals, as I call them, because somebody's going to have to end up taking care of those folks when they do get very sick. So Brian, what is the open enrollment period, and is it and when does coverage begin once you do enroll?
November 1st until January 15th, November 1st, 2021 until January 15th, 2022. Individuals who enroll between November 1st and December 15th, their coverage will start on the 1st of January. If you can still enroll after the 15th of December up until the 15th of January, but if you do so, your coverage will start February of 2022.
Oh, okay. So fairly, almost just like any other insurance plan. Once you get it before the end of the year, it'll start the first of the year. So that's great. So Benjamin, if I lose my job at any time during the year, can I enroll at that time, or do I have to wait until, say, November of next year?
No,
Or
you can enroll. You get what they call a special enrollment period. So a special election period. So you can enroll into a plan, and basically what we do is when you lose coverage, if it's a qualified health coverage, you will qualify in order to to be able to sign up for Obamacare, and so you just go from there. But you can go get signed up.
yeah, I retired a couple of years ago, and one of my friends, she retired recently, and me and other folks who are at that retirement age, we talked about, do we keep our employer's insurance plan that's offered to us, or do we get on the Affordable Care Act? How do people make that decision of which option is best for them?
In that case, you can easily go to the Medicare, not the Affordable Health Care website, the marketplace, and you just plug in the numbers with your income and find out what your annual income is and your household size and so on and so forth. And from there, and then you can determine what your cost is going to be and what your deductibles and your maximum out of pockets and things of that nature. And then you can compare it to the plans that you may have from your former employer. If it wind up being a COBRA insurance that you have, or you just continue with the one that you have. So from there, you just check it out that way and do the cost analysis, and you can see from there which would be better for you from that standpoint.
JT, let me interject to something real quick, because
Sure.
Being a physician, the one thing that I try to make sure patients understand is that, yep, you can go online, you can take a look at it, you can fill out and use the worksheet that Benjamin spoke of. And some people, that still may be confusing, and then other people may not be able to get online. As this is America. Not everybody has internet connections are able to get online like that, or even if they have the internet, they may not be fluent
savvy.
stewards, of being computer savvy. But people like Benjamin and the Hicks, those people are there to help walk you through it, whether it's by online, talking to you, or by telephone to help you get enrolled, because that's what they do. I just want to make sure, because some people still may not understand the complexity of it, even when they're looking right at it. But there are people like these guys, that's one reason we got them on here, is to help walk them through it.
Yeah, and I was going to have a follow-up question. Thank you, Dr. Kane, because when Benjamin was saying that you go in and you enter your household information. So, Michelle, I wanted to ask you, are there different types of plans, and can I get a plan for me and my children and my spouse?
Yes, there's different plans out there, and it depends on the county and your zip code. And for it depends again on the family structure, on whether the children qualify for the plan. They may have to go on CHIPS, the Medicaid program. It just depends. Individuals that, families or individuals that are looking for health coverage, they want to talk to an agent to find out what their options are and which direction they need to go. Um, and like Dr. Kane and Ben said, they do want to get their numbers together, and they do want to talk to someone just to find out, what their options are out there.
Yeah, and one of the things is, with the affordable health care, there are different levels. You have the catastrophic plan, you have a bronze plan, and the silver plan, gold, and platinum. And so each one offer different benefits. And let's say, for instance, if a person I'm going to do myself, okay? Let's say if I made the $13,000 a year, and I am in the Brevard County area, that's zip code 32907. I select a silver plan, and the first thing that pops up here on the silver plan is I have a zero premium, zero deductible, and out-of-pocket maximum of $950. My doctor visits are free. Specialist visits are $10, and generic drugs are $15. And then I can go and there's and that's with the health first. And then we have something with Ambetter is another company that's in this area. And some of the other things that we have is an EPO plan. And the EPO plan usually limit the coverage to provide who are within the plan network, but does not require a doctor referral to see a specialist. So that's the when you look at your EPO, then you have your HMO, which does require that you, if you wanted to see a specialist, that one require that you do, we work in the network and you do get a referral from your doctor. And of course, we have the point of service, and that's a POS plan, and they consider that one a hybrid plan that works with the HMO and also your PMO plan. And you need this one you can choose in-network primary care, but you can see an out-of-network physician without a primary care referral in that case. And so, but different plans, like the silver is the one that President Obama set up that gives you your subsidy that helps you.
And let me interject just something real quick, because it's a lot of people. I mean, that was a lot to grasp, and as accurate as it was, it still was a lot for some people to grasp. But the only other thing what I wanted to interject is we promised we were not going to call out, and we didn't give you this instruction. Brian knows.
Okay.
We were not going to call out individual insurance companies.
Gotcha.
Because of we don't want to seem unfair and being favorite to anybody. So you can list what those plans are about, but try to leave out the name of the provider, insurance provider.
Gotcha.
And not all the providers are in all the counties. So most counties have different providers. So you want to talk to a representative, an agent, based on your zip code. We can put it together. We can tell you exactly what providers are offered in your county based on your zip code.
And I can tell you. Go ahead, JT.
Michelle, that's always so amazing to me. And when one of you even mentioned that it depends on your zip code, that although we're in the same state, the coverage different, or is it just different because of the providers that are within that county?
Some of the coverages will have the same benefits, but the plans are different based on the zip codes you're in. Like, for instance, Brevard County would have a completely different plan, opposed to someone in Orange
Duval.
County. You know, so it just depends on which county you're in the state of Florida.
So what would the coverage variation be? I mean, I don't understand. Is it based on the diseases that are prevalent in that area? I mean, what's the variation?
No, it doesn't have anything to do with your health status. It just depends on what county you live in, and it's all based on counties.
Yeah, counties, because different insurance are in different counties.
Yeah.
They have different providers, or the network can be smaller, larger, or whatever. And you know, they've done all of their research to find out what they're going to charge in particular zip code. Or
If I may interject, we're dealing with insurance companies. So
Yeah.
with the insurance companies, the structure of the policy is going to depend on the risk management within the insurance companies. There's essential basics that have to be covered on all the policies based on the Affordable Care Act itself. But the insurance companies themselves, that's why you saw that some of the insurance companies are coming back in the market now that had left the market because they didn't want to underwrite certain risk. So it really comes back to what type of risk the insurance company is willing to underwrite.
Okay, and that makes sense.
Yeah,
Now
Brian
I get it.
He mentioned some essential health benefits, and the one thing about the affordable health care, there are 10 major essential health benefits that all of the plans, they have to cover. You know, it's like the ambulatory service, the hospitals, and then also we're looking at emergency services, hospitalization. We have pregnancy, prescription drug coverage, and rehabilitative services for mental health, laboratories or lab services that needed, and then you get the wellness each year and for preventive chronic disease and things of that nature. The wellness visit, you get one of those each year from the doctor so that they can do a thorough examination and see just what type of what you may or may not need for the year. And so you do that, and then pediatric services like that are available. And now they have the dental services available for you as well.
So one thing that I did not ask either of you is, are Americans forced to buy health insurance?
No.
No.
Because I thought it was something tied to your when you file your income taxes and you had to show proof of having health insurance. Wasn't that the case for some?
It was at one time, but then
They got rid of the mandate.
Oh, okay.
Yes,
They got rid of the
Okay.
mandate.
yes.
I got you.
I think the Supreme Court kind of had a little hand in that, right? I mean, the threat of the Supreme Court
Right.
had a little hand in that, getting rid of that mandate, because that's what that's what the Republican Party did, took it to
The Trump
court to try to
administration got rid of
disqualify
it. Yes. Yeah.
based on a mandate. So they had to
Oh,
let
okay.
that go. Mhm.
Okay.
The benefit. The benefit.
Based on a mandate.
Okay.
Somebody losing their, you can't
The
hear it.
benefit itself is structured as a tax benefit, and the argument was that because it's a tax benefit, and you got rid of the mandate, then it should have null and void the whole plan. Well, that didn't work that way. You have a
Okay.
similar situation with Part D when in 2006, when President Bush passed the prescription drug plans. There's a mandate that still exists. If you, of course, we talked about that before, was that if you don't get your Part D within 63 days of being qualified for Part B, then you'll get penalized. But that penalty has gone away, so they're not required to. No.
Okay. Thank you. And there's a question that was posted in the chat. Someone asked, what about full-time students who are older than 27? Do they get insurance on their own, or do they, if they still live at home, are they considered in the whole qualification or eligibility for the family?
No, they would actually qualify to get insurance on their own if they're a full-time student. But they want to, again, we're going to go back to that income level that they have to meet in order to qualify.
Correct.
Oh, okay. But if they're a full-time student and not working and just a student, do they then have to fall under their parents' income to determine eligibility?
They would fall under Medicaid, or again, maybe it just depends again, but Medicaid maybe, or temporary health coverage.
If they're 27, typically they're going to have to pay out of pocket for their insurance.
They're going to have to pay out of pocket.
If they're not earning income and they can't, they don't fall in the guidelines of the federal poverty level.
You guys, and I can't remember, I may have missed it. You mentioned about the minimal income. What was the maximal amount of
the max
income?
the max is 51,000 51,000 something 141 I think
51,520.
520. Okay.
No.
Okay.
That's the max.
Now keep in mind, as far as that maximum is concerned, they can still get the coverage. They just won't qualify for a subsidy.
Right.
Yeah, because
coverage or just health coverage they can get. Yes.
Yeah, and the reason I asked, because I know at one time when I had a little gap between employment and became self-employed and had a gap between some employer coverage and my self coverage. I went through Obamacare, and I made a little bit more than 51,000. But I was able to get on to utilize the silver plan and didn't have the subsidy, which still hurt quite a bit coming out your pocket, but at least I had some insurance. And you guys walked me through that, so.
Yeah, it's called off exchange. There's off exchange policies. So there's on exchange and off exchange.
Okay. So, Dr. Cain, I just have to ask you, as a practicing physician, how often are you having to vet questions from your patients about, Dr. Cain, what insurance plan is best for me? I know, sometimes insurance plans change, for instance, by your employer, and you may lose a patient because their insurance plan doesn't cover you. Do you get many questions about insurance, even though you're not an insurance broker or expert?
I get a lot of questions. I'm not going to say it's every day, but it depends on the time of year. Obviously, during the sign-up time for both ACA and the Medicare enrollment time, I get questions on it. As a clinician, we were well trained in managing medical problems. We were not that trained in dealing with insurance companies, and so I kind of had to learn through my guests, which I know all of them. They're friends, but that's not the reason I had them on the program. It's because they're smart guys and they know what they're talking about. But through them, I've gotten somewhat educated. But when it comes to the particulars, I usually have to refer to these guys, and they give you their information after the broadcast. But I usually have to refer to these guys to get the more specifics. And I do see quite a bit with people in either changing from an employer-based plan and maybe going on their own, and even sometimes, just changing from one plan to the next, depending on the provider of the ACA, who are providers within that Affordable Care Act. It will range from, and since I can't call insurance names, as I said, but there are different companies having different plans, and sometimes those plans I may or may not be on those plans. So most of the time, the patient wants to know, are you on that plan? Are you on that ACA plan? Can I still see you as a patient? And that's what I would have to ask. Or sometimes I've gotten to the point that I know quite a few of the plans that I am on. And but that's where the difficult choices come in. I really try to refer patients to think about what's best for them, not just what's best for me. So I try to be as objective as I can, even though I would love to continue to be their provider, sometimes that may put them at a disadvantage financially because I may not be part of the best plan, especially as it comes to financial and reimbursement related circumstances or in terms of paying for different things. I may not be with those best plans. And so I'd rather put it in somebody's hand who can be a bit more objective, even though I try to be.
So I guess I want to ask Benjamin, I'm going to ask you this question. So do people have options of who their doctors are when they're on Obamacare, or is it just like almost any other insurance plan? There's a list of providers and you just go down the list and kind of pick one?
Depending on the insurance company, yeah, yes, it kind of works that way. And so if you want the subsidy, the HMO plan that they have, and that's pretty much the way that you want to go. But if you're, I think they do have the POS plan, the one after where you can use someone that's out of the network. But for the most part, I think that's pretty much. Brian and Michelle, you might want to help me on this one here, on this particular question.
What I usually, oh, go ahead. I'm sorry. Oh, what I usually do is I'll ask my client, do they have a doctor or a specialist they want to keep in their plan? And then I'll search the plans that doctor or specialist takes. And then, we go from there. And if they like the plan and that's who they want to go with, they'll go with this. If they're like, no, this plan is too much, then I'll say, is there someone else that you want me to look at so we can put you on a plan that's going to best fit your needs? And I just make sure I talk to them.
Yeah, and this sounds pretty much, thank you, Michelle. It sounds pretty much like when I was working and I literally, when it was time for open enrollment, the first thing I do back in the days when we actually had several options of plans to select, and this was back in the days before the Affordable Care Act was around. And the first thing I would do is go on and look to see if my provider was on there. So it sounds like it's almost the same thing. And I like what you said. You ask people, do you have a particular provider? Because that is important, because once you establish a relationship with your provider, particularly if you have some chronic health conditions, you've worked through those things of how to get those things under control, you want to stay with your current provider. So I really like that angle. And I would like to tell our listeners, if there's any question that you have of our guests, please put it in the chat and we'll make sure that they get those questions answered. So do I have to buy new insurance under Obamacare, even if I'm insured by my employer? Brian?
No, you're either gonna have one or the other. So if individual like their employer's insurance, they can keep it. If that employer's insurance, I believe it's 9% of their gross income. If it takes up more than 9% of their gross income, it's a qualifier for them to also go to the Affordable Care Act. But the answer to it is no.
Now, there are some employers that do require their employees to accept their plan. I think they get some type of yeah, they get something. So their employees are required to stay on their plan. I usually say check with your employer first to see if you have to accept their plan. If not, then we'll go shopping for a new plan.
Thank you. And is Obama, we call it the Affordable Care Act. So is Obamacare or the Affordable Care Act or the Health Insurance Marketplace, whatever you want to call it, is it really affordable for families?
Yes. If you fit into the income guidelines, then yes, it is very affordable.
Yes.
And it gives you a wide range of coverages that was not available before. Too many people were dying before the Obamacare took place in a hospital, or should I say, insurance companies was not covered. They take your payments for years and years and years, and then when it's time for um, surgery, they say pre-existing conditions. And the great thing, the awesome thing about the Affordable Care Act is there's no pre-existing condition, and so it, I probably have at least 6 or 7 people since I've been doing the affordable health care. They have come and said that I saved their life, and I told them I didn't save their life, but they said, well, if I hadn't gotten insurance, and if you hadn't told me about the Obamacare, because they hadn't been listening to Fox News or whoever it is. I don't know if we can say that or not on here, but and they were, no, I'm not going to get it. I'm not going to get it, and so they, convinced them to get it, and they were able to do it. And they found out they had breast cancer or different type of cancers, and they were able to go and get it taken care of, and they're here today because.
So Benjamin, yeah, so you mentioned something, excuse me for cutting you off, and just prompted me to ask the question. So for persons who have diabetes and high blood pressure, I'm going to stick with diabetes for instance. Does the plan cover the supplies that diabetics need to, for instance, the needles or the testing strips or the insulin? Does the plan cover those items for them?
From the best of my knowledge, yes, they do cover that. I'm sure, quite sure there are some costs in some of them, depending on what the deductibles are and what their maximum out of pockets are. But yes, those things are covered.
Because I know when I was working at the health department, we had a lot of calls from people who were saying they couldn't afford the test strips, for example, because they're just so pricey. So I was just wondering, as does it offer some type of assistance to people who need those very important things to manage their health?
Prescription costs.
Yeah, when a person has zero deductibles, zero maximum out of pocket, and so those things are covered. Everything is covered.
Oh, okay.
Well,
There's some
the availability of it in the formularies are available. It's the affordability that sometimes come into question. And when you're dealing with especially things like insulin and things of that nature, so that comes into question. But they, with the essentials, they are supposed to provide drugs in different, all the different categories.
It depends on
generics.
Depends on what?
And
It depends on whether the drug is a generic or it's a name brand. There's going to be a certain cost, but most generic medications under the Affordable Care Act, Obamacare, you might see anywhere from $1, but no more than $15 or $20.
But that's two different issues,
Right?
In the formulary, it has.
Let me
Go
chime
ahead,
in.
what I'm talking about. It has to. They have to let you do your job.
Right.
Let me chime in on it a little bit, just as a provider, from a provider standpoint, because I thought that was probably best I play this role as a provider this evening. I absolutely agree with what the guests are saying. Two things in the preceding questions. One is, I remember how the insurance company would find every excuse they could not to pay claims to those for those individuals that needed their services. Anywhere from, they could have ovarian cancer and they had the slightest issues with the pelvic problem. Women, that can always have pelvic related issues of dysmenorrhea, of menstrual pains or whatever, regular menses. They would just find a reason not to cover those people. And so when it became that, no pre-existing condition would disqualify you from having insurance, it was it was just so great that I could count on my patients not being disqualified for being covered. As far as some of the individual medications and or supplies that people need, they're absolutely correct. And that is that sometimes we need, sometimes it depends on what their co-pays are, which depends on the plan. Yeah, you guys can correct me if I'm mistaken. What their copays are, which depends then on the plans that they have, and those copays can sometimes be depending on either if it's drug related, the type of drug, whether it's generic. Remember, all these guys, you like to hear, and some people don't understand. It gets confusing when they start talking about tier 1, 2, 3, 4, tier 4 and 5. As to being relating to what drugs are covered and how expensive they may be. The tier 1s almost are given away for free anyway, a lot of them. But then when you start getting the more expensive drugs, and truth be told, some of the newer drugs, which work better than the older drugs, will maybe fall in some of those tier related plans, and like a tier 4 or 5, and may be unaffordable by a lot of my patients, but they may still be the best drugs for them. So they still may have some challenges in terms of obtaining those drugs, but it's still much better than what it was before the Affordable Care Act.
Mm-hmm.
Okay, thank you. That was a mouthful, Dr. Cain. You were talking about Benjamin earlier. That was a lot. So I want to make a transition just a little bit. Does Obamacare or the Affordable Care Act cover dental and vision? Or is that extra?
It depends on the plan, and I usually see that in the plans for individuals that are off the marketplace, more opposed than people on the marketplace. But it just depends. It depends on the plan, and again, we're talking about different counties too.
So there could essentially be plans available, but it may be an extra or added cost to the insured.
That is correct. And some of the plans will have dental coverage for children. So say, for instance, you have someone, a household of 3, and the income is well up there. So their subsidy is going to be very small, but the children will qualify for that plan, and they would qualify for dental and possibly even vision, just the children.
Yeah, but Michelle, I can tell you here in Jacksonville or Duval County, there are a lot of adults who need dental care. What option is available for adult who may be covered under the Affordable Care Act as far as dental coverage is concerned?
They may have to purchase an individual plan outside of their health coverage.
Right.
Oh.
Let's say, for instance, I'm here in Brevard County. I'm looking at a dental plan that's $8. Has a deductible of $30, and the maximum out of pocket is $350. Adult checkup is $10. Child checkup is no cost after the deductible. And then there's some other things that are included in there. Dental is it's just one that it costs so little, but yet we wanted to cover so much. And when you start putting together these dental plans and the insurance companies that are doing the dental part of it, they have to get a lot of folks to be able to cover some of these the dental costs that the dentists and everything have. But it is available, but it's limited in some of the stuff that it covers, but it does.
So we talked about dental, but what about vision?
No vision.
Some dental. You want to answer that?
Okay. That's why it's important to have someone who knows how to navigate the marketplace.
Yes.
Because those, for an example, those ancillary services such as dental, vision, hearing. Also, you have some plans that give you access to gyms. Right. It just depends on what the person needs. I think it's extremely important that they tell you who their doctor is that they've been seeing, especially if they're used to a particular doctor. And then we can the added value issues, we can add that into it, and then hopefully come up with a premium that's acceptable to them. But
if our listeners, Brian, I have to interject. If our listeners didn't get anything out of what you just said, is pay attention to me asking the questions because I don't understand. So what I'm going to do is make sure I get and keep the Hicks phone numbers as well as Benjamin's number, because using them, they're the experts. Why figure this out yourselves? Back in the olden days, people were accustomed to insurance people knocking on their doors or coming to their house, helping grandma with health insurance or life insurance coverage. So I think the new way is to find individuals like yourselves who will help you navigate this very complex system. So let's talk about subsidies. What are subsidies, Michelle?
Subsidy is the amount that the government's going to pay on your behalf. So let's just say the original cost of a plan is $800 and you get a subsidy for $4. That means the government's going to pay $4 and you're going to pay $4. But that's just a number I'm throwing out there. So
Right.
the government's going to pay a portion of your health coverage. You're going to pay the rest. So you could pay $7. The government might pay $570.
Oh wow. How do I know if I qualify for subsidies?
Okay,
We got to get your information and we're gonna find out how much you make to determine what your subsidy will be, and then you're gonna tell me which plan works for you when we start going through the plans.
Okay.
right, because the simples, this is Benjamin. I have a zip code of 32907, age 60, and then you have female or male. Let me do a male, okay? Because it varies. But the savings that I'm going to get, and I make $13,000 a year, non-smoker. Savings I'm going to get is $930 a month. It's what the subsidy that I have available to me to apply on the silver plan, and so I have plans that range from zero premium, zero deductibles. I got them at zero premiums, 625 deductible, maximum out of pocket, 625. So it all varies depending on which insurance companies and how much of the subsidy I want to apply. And from that, and so on and so forth. And some of the plans, like Brian mentioned, they have gym membership. And so, but right now I qualify for $900, in this case, $933 a month that I get to apply.
But you said something, excuse me, Dr. Cain, I wanted to make sure I mentioned this. You said something though, I'm not a smoker, but it was said earlier that risk or pre-existing conditions don't count, but being a smoker does count.
It does.
Yes, but you still get
What
coverage.
else?
You still qualify.
And they're not going to hold that against you in terms only on the premium side of it, but it's not going to stop you from.
So you get coverage, but it just costs you more if you're a smoker.
And that's based on the activity of smoking itself,
Right.
not the underlying disease that it may cause.
Exactly.
Oh,
Not the comorbid conditions that may be existing. Okay. Yep. Well, again, what this does, in my opinion, it exemplifies why because of the complexity with what, in terms of both Michelle and Benjamin gave in terms of an example, why you need someone to help you navigate these tortuous waters of getting insurance.
Right. And there was a question posted online. It says, is there any support for mental health counseling or services during COVID?
Excellent question.
That's part of the plan too.
Well, that's part of part of the essential.
Yeah,
That's part of the essential, the mental health and subsidy.
They have to have coverage for that.
Or they can pay out of pocket on their own.
Which
Not.
You don't do that.
The affordable health care is the bomb. I'm just telling you right now. I know a lot of people may not, well, some, not a lot, some may not think so, but it's the bomb. That's just from my standpoint. Anyway.
Meaning it's a good option for people who may have previously been denied coverage because of those pre-existing conditions.
Yes.
So if I have Obamacare and I'm nearing age 65, what happens with my coverage? Do I have to switch to Medicare or does it automatically happen? does it automatically switch me?
No.
No,
Go ahead.
it's illegal to have both.
Right. So
But do
we'll
I
switch.
have
You gotta
to
switch.
do I have to switch to Medicare, or do I keep just I can keep my my affordable
You can
care
switch.
plan?
You could keep it, or I would say take the Medicare, because you're going to get your options are going to be a lot better.
If you have enough work quarters, and the Part A of Medicare is typically issued automatically, okay? It's the Part B that you have the option to turn down. So if you become eligible for Part A, it is illegal for you to have the Affordable Care Act also. Now, I do have a few clients that moved here from other countries that and they're past the age of 65, and they're still on the Affordable Care Act because they don't qualify. They don't have enough work quarters to qualify. In that case, it's allowable. But other than that, it's pretty much it's cut and dry. You cannot have both. When you get qualified for Part A, you don't even have to be qualified for Part B in Medicare, and you have the Affordable Care Act. You have to relinquish that coverage.
And I would like to ask. I do remember last week when we were talking about Medicare, for those that joined us last week. And if you don't apply for it in the timely manner that Medicare asks you to, that 7-month period that you need to apply for it. If you qualify for it, but you continue to use your Affordable Care Act instead, would you then still be penalized as if you would if you didn't apply for it before because you didn't have insurance, or not penalized like if you had employer-based insurance? If you guys catch my question.
Well, employer-based is a different category.
Right.
You can maintain your employer-based insurance and have
And be
Medicare
okay.
at the same time,
Right.
but not the Affordable Care Act and Medicare, because we got to keep in mind that the Affordable Care Act is based on a tax credit, a federal tax credit. And when people decide that they do want to apply for the Affordable Care Act, not only even if they can navigate through the website and find out what coverages they want, there's other complexities that come into play too. They're going to have to file what's called a 1095-A to get the tax credits. So they can do what they call a reconciliation on their taxes. So there's and the other thing is that they have to understand how these coverages work. With their, you have to be able to look up the doctors, and it's just, you can do it on your own, but it's better to have somebody involved that does it all the time.
Well, let me simplify that question a little bit more. I just want to make sure that should you have affordable care, and then you become eligible for Medicare, but you decide to keep the affordable care, okay? Then will you be, if you eventually did go over to Medicare, would you be penalized for not going to Medicare earlier when you could have?
You could be penalized on both ends, depending
Okay,
on you can get a penalty from Medicare for delayed Part B, or you can also get a penalty for taking those. Well, you'll owe your taxes when you do a reconciliation on your taxes. If you've taken that subsidy, the subsidy is not like here's X amount of dollars,
free money.
Go at it. It's based on legally, it's a tax credit.
Got it.
So if you take that tax credit and you actually qualify for another government program, which is Medicare, yes, you will.
Okay. Now, I just have one thing to add to that is, and again, you may be penalized, like Brian was saying, but you would have had a qualified health coverage. So would that come into play in this situation? Even though you may have pay tax wise, you may pay some things, but when it comes to your Part B and so on and so forth, with you being a qualified health coverage, with that, you still be penalized from that standpoint, and even your prescription drug coverage as well. That one I don't know. I'm just asking the question. I'm
On
assuming
which
that's
part?
you're asking Doc.
On which part, Ben?
I'm saying because of the affordable health care is a qualified health coverage, and it so now a person with Medicare, when they eventually do switch over, would they be penalized because they would have had a qualified health coverage? So it's just like working with an employer that you have a qualified health coverage before you come in with that.
Unless it's with your employer, and if you are getting a tax credit, because when you're with your employer, that's a different structure. The tax credit isn't attributed to you and when you file your taxes. You don't have to file what's called a 1095-A with the IRS. That tax credit is worked through your employer. So that's a completely different scenario. If an individual, let's say an independent contractor, has Affordable Care Act, continues that policy, and also qualifies for Medicare, then that act is illegal. You're not supposed to have both.
Yeah, but if they don't take the Medicare, is what I'm saying. If they don't take out the Medicare, they don't go and file for the Medicare. They just continue with the Affordable Care Act.
Now,
If eventually a year later they decide, okay, I think I'm going to go on ahead and do Medicare now instead of
here's the
Affordable
thing.
Care
I think Affordable Care Act automatically they start to send you letters, and
Okay.
Medicare is going to send you letters. So at some point, I think one is going to. I think it does cancel out. And
Yeah,
then
because
Affordable Care, you have to take,
Okay.
you have to get the
Okay.
Medicare. Now,
when you turn 65, yeah, the
when you turn
Medicare is going
65,
to
they
be
tell
sending
you,
you
they're
a
going
letter,
to tell
at
you
least Part A,
that you have to go.
and the
Okay.
option is Part B.
Yeah,
All
they're
right.
going to tell you, yeah, you're going to have to,
Well,
you don't have to get Medicare, but you got to get out of here. No, I'm just kidding.
I wasn't intending to make this too complicated, but JT, go ahead.
So I'm planning on getting married or I'm getting divorced.
Mhm.
How does that impact my coverage?
If you're married and you're on a plan with your spouse, and you decide you're getting a divorce, then you would just get an individual plan. You can go and do a separate plan. Somebody's coming off of that plan. Whoever's keeping it can keep it, and the other person's going to have to get their own coverage.
Okay. What about the children then?
Children, when you're adding or taking children off, it's basically the same thing. You can either add them to your plan or take them off your plan.
It depends
Oh, okay.
on who writes the children off on their taxes.
On the taxes.
That's because it is a tax credit. We got to come back to that. It's a tax credit.
Okay. All right. Thank you. And, Brian, this question is going to sound familiar to you because you were on with us last week, but I will not pick on you and pose the question to one of our other guests in how do gay couples factor in to Obamacare? I asked the question last week for our listeners as far as Medicare is concerned, but how about Obamacare if there are some same-sex marriages out there because of the federal law with that? Are people able to get a family coverage under Obamacare?
It still comes down to whether or not they're on the same tax return. If they're on separate tax returns, then they'll be treated separate. It comes back to whether or not you're on the tax return when you file your taxes, and whether or not you're going to file a 1095-A or what your dependents are on your tax return, and that's what it really depends on. And it's difficult, just like when we discussed before with the Medicare, and it's difficult. Medicare is an individual policy. As when you sign up for Medicare as a beneficiary, that's the individual. There's no such thing as a group Medicare policy. So based on that, the only real challenge that really comes about is that if the work quarters, if an individual, if a couple were gay, and one of the members in the relationship stayed home, raised the kids, did whatever for the last 20 years, didn't get enough work quarters, 40 work quarters, then that's when that could come into play. And then in that instance, then they would be able to benefit from their spouse's qualifications, work quarters, because they were a non-working spouse.
Okay. Okay. So how about if I'm a vet? Should I get the Affordable Care Act, or should I get whatever coverage is available for military veterans?
No.
If you have TRICARE, you want to keep it, but you do qualify.
Okay.
I'm a vet. I'll tell you, with the vets, okay, the vet, depending on what type of coverage you have through the VA.
Correct.
If you've done 20 years, you have TRICARE, then you want to go with that, okay. But if you have full access to and you're getting all your health needs met by the VA, you want to stick with that. But you can also, because of the separation between civilian and military, the vet can have the Affordable Care Act or Medicare and their VA benefits. It's not wise to do that when they have TRICARE, though, because that's more or less like a supplement that covers everything, whether you're going to a civilian facility or a military facility.
So how do people? Still, I can't figure out. How would I know which one should I get? Again, do I look up one of you for you to help me figure that out? Or do I go to the VA or call the Veterans Affairs to help me figure it out?
Oh, I didn't mean. Oh, sorry. Talk to one of us, and we'll walk you through it. I have several people that get their medicines from the VA, okay, but they have full Medicare. They're allowed to do so now, because that's on the prescription drug side, because the prescription drug coverage from the VA, according to Medicare and the government, is considered what we call credible coverage. So in each individual's situation is going to be different. There's also some allowances if a person tends to go mostly to the VA for all their services when they need civilian care, and so there's some allowances there. So it's a little different when you're dealing with a vet and they qualify for care through the VA, and they can still have Medicare and or the Affordable Care Act.
And let me add this as a provider. A lot of times I'm getting patients whom they see the VA for quite a few of the services. They take advantage of the lab services and take advantages of radiological services and different things of that nature. And even the prescription drug plans, they take advantage of it. But then they still want a particular doctor to oversee their health care. And so sometimes as a primary care provider, especially to my primary care providers, there may be, we can work in tandem with those VA primary care providers. So people, a lot of times they see me and they see them because there are certain things that they would like to get from the VA, but at the same time, they kind of want the stewardship of a primary care provider that's not within the VA system to be able to help walk them and guide them through their disease and management processes.
Look, Dr. Cain, I would go a step further and say they need. I mean, the reality, that's just the reality. I get letters all the time about come take advantage of the VA services. I use commercial insurance, for various reasons. I mean, a long time ago when I was deployed overseas and I came back, and I went to a particular hospital on the base for something simple. they left me in a bad situation, and that's not always the case. I don't
Right.
want to shine a bad light on the VA, but for me, as a vet, I would rather have a doctor like Dr. Cain overseeing my health than the VA itself, because the VA, your doctor will be there today, gone tomorrow. Depends on what his papers have him do. So
Right.
if you want the longevity, you want somebody that understands your health problems, you want somebody you can communicate with and get the best of both worlds. I mean, and I tell people, like when you talk about dental in the VA, when I was in, they did one thing for us when we were overseas. If you went to the dentist, they could either pull all your teeth or I'm serious. They said we can pull all your teeth or just the ones that hurt. That's it. That's your dental care.
Well,
Wow.
the reason, and I do see, again, and there's some of my friends that went and started working. I'm here in Jacksonville because I'm here in Jacksonville. I've seen, some of my friends or people that I know, colleagues or whatever, went and worked for the VA upon their retirement from civilian life. And we would work in tandem. We communicate with each other to a great degree to make sure the patient got the best of both worlds. But then there are also circumstances where some people and you can get good, bad, and ugly and under any circumstance, including civilian or non-military services. But we work in tandem to try to do what's best for patients. So you do have to pick and choose, what's best for you and who works best for you under those circumstances. But don't forget that you can do both. And the one thing I need to make sure we say this before, because I know we're getting close to the end of the program. I need to ask this question, and I know it's not on the questionnaire that we usually ask. Is there any cost to people to utilize you guys' services?
No, we're paid by the insurance
Absolutely
carriers.
not.
Oh, that's what y'all do it, Brian and Michelle?
Mm-hmm.
Yeah, there's no cost. No cost.
I don't know about that extra stuff that Ben's doing. Okay, I don't know.
No cost.
Yeah, but generally, all you guys there's no cost on it, right?
No,
Right.
it's no cost.
Yeah. I just want to be sure people got that message.
No cost.
That you guys aren't going to cost them an arm and a leg, but you're also recognized as legitimate
We're all
educators and
certified.
navigators
Yes,
for
absolutely.
all the systems that we were referring to this evening. Okay, JT, back to you.
Well, I mean, that's it. I think we've asked all the questions that I can think of, and I've been monitoring the chat, and I don't see any more questions in there. So, Dr. Cain, I don't know if there's anything else you'd like to ask. Otherwise, I'd like to give our guests an opportunity to first share anything that we have not covered, and more importantly, share your contact information so our listeners can reach out to you for assistance, especially now that they know that they don't have to pay you.
And we'll put it on the website, that information, but go ahead.
I just want
So,
to
Ben,
share. I'm
go
sorry.
ahead, Michelle.
Well, I just want to share that the reason I do this is I know that in the past there have been a lot of people that were out there without health coverage. And I believe that since the Affordable Act came into play, that everybody that has the opportunity to take advantage of health coverage should take advantage of it. And I'm here to walk you through to get you on the plan that best meets your needs all throughout the state of Florida, so that we can make sure that you have the health coverage that you need for yourself and your family. My client comes first, and I treat everybody like a family member. You're part of my family. Once we get you on a plan, you have someone to call every time you have a question. It doesn't matter how big or small, or you're curious about something, call me. That's how I run my business.
Thank you. That was awesome. What about you, Brian? What's your final thought that you'd like to share?
Well, my final thought is this: through the complexities of the health system, individuals have to realize that when you apply for coverage, and not only do you get a letter of eligibility to tell you how much you get in your subsidy, but then also you'll have to upload certain documents. You have to worry about your 1095A, make sure you're doing a reconciliation, because if you don't, you can get penalized for that also. So I think that where I get the most satisfaction with this is being able to navigate people through the process. Now, whether or not they want to go with me as their broker, that's another issue. But and this is all in all honesty, I learn from every case that I deal with when I help people, and that's what I get from it.
Thank you. And last but certainly not least, Benjamin.
I just like helping people, and I agree with each and every one of those, and concur with what they just spoke the same here with me. And I just think that affordable health care is one of the best things that since sliced bread. So,
Yes.
That's pretty much it for me.
I did forget one question to ask you. If I am a disabled person, should I have the ACA, or should I go with SSI or something? What's the difference in coverage for a disabled person?
They would still.
Okay. You got.
Go ahead.
Okay. It depends. If it depends on whether a person is on SSI or SSDI, which SSI is not based on the amount of money you earn. So you can as a child, you can be placed on SSI or SSDI.
Okay.
But once you have been on disabled for 2 years on SSDI, you can no matter what your age is, under 65, you can go to the Medicare system. Again, is knowing how to navigate the system. So SSI is under another category, which is called managed care, which is run by the state. Typically, it's funded by the federal government, but it's run by the state. But the SSDI is federal, is federally funded and run by the state. So I can't tell you how many people that I've run across that have been eligible for Medicare for a number of years under the age of 65, because they don't automatically send it out to you when you're under 65. So and they could have been on the Medicare system and took advantage of all the Medicare Advantage plans, the zero premium, and the other things, the dual SNP plans, what we call special needs plans, that in the state of Florida, if you're what we call full dual, or you are full Medicaid, you can't be balance billed, meaning that whatever's not paid by Medicare is then paid by Medicaid, and you don't get a bill. So you got a lot of that out there, and I just that's people have to. I'm not saying that they have to trust everything, but they have to trust in something, because even being in this industry, there's things I learn every day.
Okay, thank you. Well, I think if you listened to last week's show or you listened to tonight's show, hopefully, I know you had to learn something. As if you heard last week's show, I am still so confused about Medicare. But the good news, I've met some folks through this podcast who I can call to help me navigate the complexities associated with Medicare, the Affordable Care Act. And if I'm not mistaken, I think any of these folks are available to help with any insurance coverage that I may need for myself or my family. And for those of us who help the elderly folks in our lives, that there are resources for us. One question that I did not ask is, how do you enroll in the Affordable Care Act?
Call 321.
What is the number, man?
There's a number. There's a couple of ways. Ben is right. You can call either one of us agents. We can get you enrolled, or you can call the Marketplace Direct and they can enroll you, or you can log in and enroll yourself.
I think it's a good segue for Ben to finish his phone number.
So we'll go ahead and give Ben, you can give your number, and if the Hicks want to give their number, what's your number, Ben?
It's 321-220-4216.
321-220-4216.
16, correct.
I mean, let me let you say it again.
Yeah, that's it. 321-220-4216.
And that's Benjamin Cain.
Correct.
And Michelle or Brian, your number?
Yes, our number is 800-716-1866. And there's always a live person to answer. Insurance Services.
Fantastic. And that's 800-716-1866. Well, thank you all so much. You have been absolutely amazing. Wealth of knowledge. We really appreciate your coming on. Dr. Cain, is there any final thought that you'd like to share this evening before we sign off?
Yes. Let me say this. Just like when it comes down, I think people should treat insurance, Medicare, the Affordable Care Act, and even commercial insurance. They should treat it with the same respect they treat doing their taxes. You know, some people can go out there and do their own taxes, but taxes are so complex in terms of trying to make sure you file them right and don't get in trouble and save as much money as you can. You know, navigating these, the Affordable Care Act and Medicare and other insurance services is like trying to file your income tax. You need someone to help walk you through the process. And so what we've heard tonight are people who are great navigators and facilitators in terms of the process of signing up for your healthcare needs. And I think that people should keep that in mind. We put in the private chat, 800-716-1866. But what we failed to do was put Brian and Michelle Hicks with that number. And then also let's make sure that in the chat, we also, when we do the 321-220-4216, that is Benjamin Cain and not Benjamin Cain. And with that, I will say good night to everyone. And thank everyone for joining. We forgot one thing. We are, to the listeners, it's not about insurance at this time, but we have this come to a new platform in terms of how easy it now becomes to join us on our weekly discussions. And at this point, you can just go to www.pauseforthetruth.com, and it will bring you right into these right into the podcast. And we will also make sure that you'll be able to get that they have access to it now more than just your cell phone, but you can also access it from most of your mobile devices, including the your laptop and your iPad and your cell phones. So we're going to list those out in terms of on the website as how easy it is now to join us.
Yeah, and thank you, Dr. Cain, and would like to give a shout out to our technology expert, Tyrone Jackson. Call Tyrone. He can help you with all of your computer needs. He does a fantastic job. For the past year, we've been meeting, he and Dr. Cain and I, and trying to find the best platform. And we've now transitioned, as Dr. Cain says, from our old platform to the new platform. And all you have to simply remember is www.pauseforthetruth.com. Thank you so much to our listeners, to our guests, and to for your expert wealth of knowledge. And to our listeners, if you have any ideas or suggestions for future show topics, please send us a message at info@pauseforthetruth.com. That's info@pauseforthetruth.com. And thank you so much. And join us next week as we continue the discussion and tell you what's really going on about health, legal matters, social justice issues, you name it. Anything that is going on, we are going to pause for the truth and tell you about it. Good evening, everyone.
Good evening.